Good day, everyone. Good morning and good evening, wherever people are listening to us. And as you all know, my name is Dr. Khan, clinical psychologist, psychotherapist, speech and language therapist, and I'm working as autism advocate, mental health advocate, and we just thought that just have some web series, you could say, not form of series, but some webinars on importance of or understanding mental health. So today we are going to talk, and I'm doing this with different communities. And today I'm going to talk about depression and anxiety. And it's a very common occurrence condition, you could say that, and maybe the most, according to some researches, it is number third or fourth, the most you could say diagnosed condition in people. But we need to understand that if somebody is not able to get those therapies, or he's not able to get to a therapist, or he's not able to get to a doctor, what he could do, what he or she could do, or how they can understand that what is depression, what is anxiety. So if somebody around them are facing some problem like that, so they can identify and they can help those people on time. So let's start our presentation. Can you see this?
Yeah,
Okay.
yeah, I can see it.
Okay. So it's depression and anxiety. We're talking about
Yeah.
both, and I will little bit talk about stress too. So let's start. Now I'm talking about stress because people say that,
Okay.
and I have seen a lot of people who would say that a little bit everybody is going to be with a little bit stress,
Yeah.
and people are having somehow, you could say, just give me a time. So we're talking about stress, what stress could be, how stress could look like. Sometimes you feel that you're okay physically, but even then you feel pain in your body, you feel headache. So what a stress could look like. And sometimes people go to doctor and the doctor say that no, you're feeling okay, you're perfectly all right, but you're just took some tension and you're in the period of stress. So what a stress could look like. One thing is that a person who is having stress, it could be headache. The person might have high blood pressure, low blood pressure. The person might feel that they have chest pain, and I have seen a lot of people who go to the doctor and they don't go to, you could say, they go for ECG also, but their heart is working well, and their ECG is also normal. So they might feel chest pain and heart palpitation, like I already told you that, and they will feel like their heart is racing, and they could have skin rashes and loss of sleep too. It's like that they will feel somehow they don't want to go to some place, they don't want to do certain activities, but might be the indication of stress instead of depression and anxiety. Now let's see that how depression and anxiety feel like. Okay, now let's talk about anxiety. When somebody is having anxiety or somebody is facing anxiety, that person might be feeling fear, or sometimes the situation is not happening yet. Sometimes they are going they're going somewhere outside, they're going to some institution, or they're going for some some traveling, but even then they might be feeling some kind of fear. I don't know, fear means like they would feel that I don't know what is going to happen with me. Maybe if something bad happened to me, or maybe I've got an accident, something like that. So if somebody is having anxiety, the person might have fear, they might feel panic. And when somebody is panic, the panic is more like person have heart rating palpitation. Okay, the person heart would be rating very high, very fast, and like it will be having something inside their stomach. They will feel afraid to do something, and they might feel threatened too. Like one of my clients is saying that she feel that she's going to die, and all of a sudden this fear came into her, and she start feeling anxious, and she feel that because something is bad is going to happen with me, and I will be all alone to face all this, and worry. And sometimes the worry would be they would not understand that they are afraid of what is the reason of why they are worry a lot. And like I told you that there could be panic attack. It's like sudden rush of emotion, sudden rush of energy. Or sometimes somebody would feel, if somebody is having some kind of panic attack, that they don't have energy in their body. They might feel numb, they might feel dizziness. And the other thing is that there might be not a clear indicator or clear triggered, that what triggered that anxiety. So it could happen to that person at any time. But it's not about that something happened then a person would feel anxious, or he might have anxiety. Sometimes the person is going to some place, or some person is afraid of some experiences that could give that person anxiety. So next, going to talk about, now let's talk about what is depression. Okay, so in depression is more like the person is feeling discouraged of something. Means that something is going, like, you will feel that you don't want to do certain things. You're not up to certain things. You don't want to go outside. You don't want to eat something. You don't want to go to some function. You don't want to go to your friend place. So it's more like you're feeling discouraged to do something, and it also include going for sleep, going for going to school, going for sleep, changing your dress and something, and overall thing. So the point is that the person would feel discouraged. The other thing is that sadness, and the person might feel sad with no reason, or it look like that the person is sad all the day. And the feeling might be hopelessness. Like for example, I was just giving the example in anxiety, that the person would say, or the person would feel that nothing is going to change. Now if something bad happened, nothing is going to change, and it will remain like that. So they totally lose their hope. They might have anger or anxiety anger attacks. Like they would feel like they're angry with no reason, and there is no apparent reason why they're angry. So other thing could be that lack of motivation and interest in journal life. It also include their food, it also include their job, it also include their education, it also includes their relationship. And as a whole, the person would feel that that energy is totally low. They don't want to do anything, and it might affect their um, eating habit, it might affect their sleep, it might affect their overall feeling. So the other thing is that what a person could feel is overwhelmed by daily tasks or personal interaction. Like the person would not want to do those things. He might feel that something is off. They don't have energy for that. And their personal interaction would be, you could say, affected because of their depression. So that was a little bit about depression, anxiety. Now I will say, I will talk more about, you could say, about those things in detail. Okay. Now let's talk about anxiety. A person might feel anxious, or anxiety could attack a person when before any major life event. You know, something didn't happen, and that person might feeling that, or he might have anxiety attacks. And when making important decision, the moment, and the reason why people are anxious, that it is like when you're having some kind of a problem, or the response of that person would be, you could say, trauma driven. you know Trauma might be from the past life, trauma might be something you have seen in front of you. So that is something that give you those kind of feeling, that if you want to make some decision, what if something go wrong, what if something didn't turn up. For example, if I'm doing this presentation, I would feel, oh, what if people don't show up. And what if I'm having some kind of interview, and I feel, oh, what if I'm not able to give that interview. So it's more like that person is having those kind of thoughts, sometime before event, sometime going toward that place, and sometime uh, trying something new, making something new decisions, and difficulty managing fear and worry about that thing. And they would not understand that what kind of fear is this, and where worry is coming from. The mood of the person would be irritable, physical restlessness, and it's like they're sitting on the edge. It's like they don't want to do anything, and even it will affect their eating too. And it was like, you know they would feel like that everything is upside down, nothing is working for them. Then there's a sense of dread, doom, or panic. Like I was just talking about panic attacks. In panic attack, it's more like rush of energy in your body. You're so afraid, you don't understand what to do. your body's you're racing, your body is racing very high, you are not able even able to take breathe, and your heart is palpitating. So that is some kind of a, which is called panic kind of a state. Then it will affect sleep problems. Like if you are thinking all the time, it means, there are different types of anxiety too. It could be obsessive compulsive disorder, it could be panic attacks. Panic is also coming sometimes, sometimes people have panic attacks other than anxiety too. But it could be OCD, it could be post traumatic stress disorder, it could be anything. But the point is that the person might feel about the person might feel uh, or they might think about that thing again and again and again, and they don't understand that what is going to happen, because in front of them everything seems so confused and so collapsed, so they cannot understand. And if a person is in that state all the time, then it gives them sleep problem, it gives them persistent fatigue, it gives them brain fog, like they're not able to think because there are a rush of thoughts from every side. And physical symptoms could include headache, muscle tension, nausea, and diarrhea. Like it could affect, I'm working with a girl and she's having, the moment she get uh, uh, anxiety attacks, or you could say that she have anxiety of and journal thing, and if something happened in, and that add additional things in her life, and she's feel that her stomach is upset. And there are few people who have IBS too with anxiety, because as a whole it is affecting them. Now let's talk about a little bit about depression in detail. Okay. Although sometimes the depression more like look feel down, more like feel look so sad, empathy. But what it could be more than that, because a lot of people depression is more like a person is feeling down, but it could be more than that. And what it would be: loss of interest in all enjoyable activity, that is usual activity, hobbies. A person who is facing who is in the phase of depression, he will not like, or he or she will not like what she was doing before. And that also include going to school, going to friend house, doing certain activities. Then sense of hopelessness and pessimism, anger, irritability, and restlessness. And anger and irritability is coming from the side of, and restlessness, because a person don't understand what is going with me. Because when you are feeling so low and you are not able to move your body, you feel like that you cannot do something and nothing is going to happen, make sense for you, then it directly affects your mood. And sometimes the person mood might be low, sometimes the person mood might be very high, the person might feel very impulsive, and the next moment the person would go down. So it is more like shift in the mood. Chronic fatigue and sleep problems, because sometimes person is very high, sometimes person is very down. It also affects their eating habit. And if you're thinking all the time about certain things in your life, and that it definitely give you fatigue. Change in appetite and weights, some, and for some people they might eat a lot, you know like they were they are using eating as their mechanism, defense mechanism, in terms of getting away with the thoughts. So it could affect their weight. Sometimes people stop eating at all. This is what is happening in few people. And some people, it could be they would eat less. So it could happen with both kinds. Sometimes people would sleep more, and sometimes people would sleep less. Sometimes people will not sleep for 2 days, or sometimes people will sleep for 48 hours. So it is something like that. And difficulty in concentrating, making decision, and remembering information, because you're in that phase when you think that everything stopped, and you're in that negativity loop, you're in that vicious cycle loop. You don't understand and remember anything. So that's how it could affect your decision making. You don't want to do things, you don't want to excel in something, you don't want to read something, you don't want to prepare for your test. So that's how it is getting difficult for you, things get difficult for you. People also have unexplained itches and pain in gastrointestinal concern. And for that things, for those physical problems, it's like their psychological problems is converting into physical problems. So it's more like a psychophysiological condition now. And they would go to the doctor for so many reasons, for so many times, and the doctor would say that you don't have those problems, you don't have those issues. And they might have feeling of guilt, and they have, like, it's more like that. They might feel more negative about themselves, they might feel more guilty, worthlessness, and helplessness. And they would also feel that everything is happening because of them. They are the cause of all problems, they are the cause why they are not able to do something, they are the cause why there's nothing in their life, they're the cause why people are not happy with them and things like that. So it's more like self-driven kind of a thing. And thoughts of suicide, death and dying, and it might start from suicidal thoughts, because if you feel worthless, hopeless, irritable, guilt about certain things in your life, it might, and it turn in a lot of people to um, go toward the negative side of themselves. And and the only thing, if they feel so many problems in around them, and they think that if they, the only solution to all the problem could be if they take their life. But we all know that is not the reality. But at that time they might think that, no. Let's talk a little bit about similarities. What are the similarities in depression, anxiety? People are still having the problem. I don't know what is the problem with the internet. Okay, so now let's talk about similarities. What could be similarities? Change in sleep pattern, change in energy level. I'm talking about similarities in depression, anxiety, like in both. What are the similarities? Change in sleep pattern. It could happen with both people. With both, it could happen in both disorders. Change in energy level and increased irritability. It could come in from in terms of aggression, anger fits, and fighting with people around them. It could be fighting with their children. It could be fighting with their spouse and with their family and their colleagues also. And aches and pain and stomach issues that have no clear cause. Like I already told you, the point is that when people are in those conditions, like if either they're facing, they're having depression or they're having anxiety, it affects because it is more like a hormonal kind of a thing, that people hormones are not in the balance, and they're all in the state of trauma. They're all in the state of you could say in emergency like state. So when people have some kind of emergency, then their all body systems are so alert, and people are so, you could say, used to those systems, that when they are not happening with them, then they're looking for those things, what is happening with us, and they think that uh, they have nothing to do in their life. So it's more like their whole life is revolving around that. Can you understand what I'm saying? Can you hear me properly? Noma, can you hear me?
Yeah, very well. I can understand everything. Thank you.
So now I think you are able to understand a little bit few more things. That is the reason why I'm doing those things. Okay, so let's see what happened with anxiety. You can, because there are, what are the differences if we say that it is anxiety? But in anxiety, what it could be, stuck in cycle where you explore over and over all the possibility with the same situation, and you could not grow without that. It could be revolving. It is kind of a vicious cycle about that same thing, one situation, and you might explore everything. And from exploring, I don't mean that you physically explore those things. You will think about that, and you will think about all the possible scenario. And if you're afraid to do something, you will think about all the negativity that could happen with that thing, that make you on the go, that make you feel bad about everything around you. And if somebody, if you will feel that, if something bad happened at that day, some major incident that you had a fight with someone, and you would say nobody loved me, then you will try to remember all the things, all the incident in your life, that this person did this with me, this person did this with me, because we are bad people, or you're not worth to love in our life. So it's more like you could say, if somebody is anxious, then the cycle, it's kind of a cycle, and you're trying to exploring the same thing. And the thing is unable to stop thinking about that thing at all. Like if whatever you do, you will feel that you're thinking in your sleep also. When you're sleeping, a lot of my clients say that their brain is on when they're sleeping. So it's a thought pattern, and sometimes they say that they sleep with something, just continuously thinking about that, and then when they wake up, it's more like, to be continued kind of a thing, that they start thinking about same thing until and unless that problem is gone from their life. And it's not even about that. Sometimes they sort out that thing, and that problem is gone. Even then they feel that way. So it means that there might be something is happening around with them. How many people are here? Okay. Thank you. Thank you. I thought we have. I thought Isa is not here. So you're getting the idea that unable to stop about that thing. It could be a small thing. It looked like that it is a small thing, but their brain is like a trauma-driven kind of response they are giving. And it's sometimes it's not that, sometimes people think that, because I'm not talking about the problems over here. I'm not talking about the types of anxiety over here. I'm just talking about general anxiety. Because if you talk about labeling those things, if you talk about what is the disorder, is it either it's OCD, there's a panic disorder, either it's a PTSD, there's acute stress disorder, what disorder that is, but even then, it is like that a person was not able to stop thinking about that thing at all, and they could not do anything about them, and it will make them feel more uncomfortable when they understand that they cannot do anything about that. And it is a problem that exists over there, and they have to wake up every morning to see that problem. So it is kind of a stress for them. Okay, now, but what about the anxiety? What about the depression? When with depression, you might find yourself fixate, fixate, fixating on guilt about not having energy to spend time with friends. And I have seen a lot of people who would say that they have wasted their life on useless thing. Now they don't understand what they can do right now. And they also, I am giving you some verbatim means some discussion that my client did with me. And they said that my friends are doing this, my this friend is doing this, my this class fellow have achieved this, my other class fellow have achieved this, my cousin have achieved this, and I'm not able to do anything at all, and my friend is going forward and I'm going backward. And it's like I'm moving backward. So that is how they think, like, that they're not able to, and it's more like a guilt driven kind of a thing, that they have guilt about something in their life, going over and over past event, and they're more, oh, let me tell you something. If we look toward what is writing over in anxiety and what is writing over depression, in depression, it is something about past. They're staying in past. And if we talk about anxiety, it's like you have experiences in life. It's not that you don't have experience, but over here, a person is going to worry about future, and the person is sometimes worry about the things that is going to happen, not happened yet. Like, I'm talking about presentation, I'm talking about somebody is going to school for traveling, and they are feeling anxiety about that. But over here in depression, a person has fixation about their past things, and going over and over past events and blaming yourself for things you have no control over, including feeling of depression. Like, you know when we are in classroom, whenever we are doing something, or it is a very natural thing that people have disagreement on something, and from this agreement sometimes the debate is very heated, that it might turn into some kind of fight. And if somebody is the thought is depression driven, then that person would say that is because of me. I said this thing. For example, one of my client was saying, I said this to other person, I don't like certain food, and that person start fight with me, that you always know you're very nosy, or you're very noisy, not noisy, sorry, no, not very, you're very noisy, you don't like those things. And she might having some kind of uh, sensitivity to food, and that's why she's not eating. But other person is not understanding, and the person who might have trauma kind of, or you could say depressive kind of driven thinking, that person would think, oh, I am the problem over here, just because of me that person feel bad about certain things. So it is more like the thought pattern is more like guilt driven, and it's more like people are blaming themselves for those things which they cannot control. For example, if you are going to some marriage, and some car was not functioning well, you know and the tire is burst, and the person would think that is because of me, because I'm sitting in that car. So it's like the person is blaming everything on themselves. So I think it's clear now. Is it clear to you, Norma?
Yes.
Okay, what about you, Isa? Do you be able to understand what I said over here? Hmm? Okay. Just a minute.
Hello.
Somebody saying something?
I just saying hi. Maybe I came very late.
No issue. You
But
will get some
the
point. No issue. Okay, you will get
yes,
some.
I joined you guys very late. I was not at the starting, but happy to be part of the program.
Okay, we will do discussion after our presentation. Little bit is remaining. So now we are going to talk about.
Pardon?
What you know, because it's more like that. If you don't have the chance to go to some doctor at the moment, and you don't have a mental health professional in your area, and if you see that your family members or your friends is suffering from something, what you could do about that? No. If you want to see this in something, and you can also observe those things in yourself. Okay. Just ask this question from you. Am I spending a lot of time in worrying something? Like, you can ask this question, am I thinking about my past all the time? Do I feel sad? Do I feel empathy or hopeless often? Do you feel like that way? Do I have lost interest in things that I used to enjoy? And if you want to think about somebody else, if it's your family members, if your friends, if your siblings, if your parents, you can check all those things in them, and then you can understand that these people are having some kind of major problem in their you could say major kind of depression, anxiety they might have, and they might need some help. Or you could say you need to give them some time, and they're struggling with something, because sometimes people are not sharing their problems, and maybe a lot of people are not comfortable in sharing their problem. But we need to understand that if somebody is around us, then we need to support those people. So you need to ask yourself, and you can check that. Avoid spending time with friends and loved one. Check this about yourself and your loved one, and in your other people that they might have those kind of problems over there. Do I worry about things I can't control to point where I have hard time thinking about anything else? Like, you're thinking about so many things at the same time that it is null and void kind of a thing. Do I become irritable or annoyed more quickly than I have in the past? And this, what you could tell this your friend or siblings could tell them that you are very angry now. Why you're angry, and you're fighting with us all the time? What happened with you? So that is a little bit kind of a check anybody could give to you. And do I feel restless, edge, or unable to relax? Like you're sitting in the chair, like you're not able to sit somewhere. You're in the state of go all the time, and you don't even understand that what is happening with me, what happened with me, and why this happened with me. Next thing is, I often feel less. We just talk about that. Do I cycle through thought unwanted and fearful thought I can't seem to stop? It's more like this, the person is having those kind of thought all the time, those negative kind of thoughts all the time. And is it difficult to fall asleep because you're thinking all the time? You cannot sleep, you cannot eat properly, and you cannot have a proper timetable in your life. It's because of the difficulty you have in the life. Have I noticed unexplained pain, tension, and other physical symptoms? Like, when we're talking about the symptoms, we talk about people might have problem with their stomach, people might have problem with their they might have body rashes, and a lot of people who might have anxiety, depression, they also go through IBS. And does this changes affect my daily routine or relationship? You need to ask that. Whatever we described in the previous slides, does it affect your life or not? Does it affect your relationship? Does it affect your education? Does it affect your communication or not? So that's all the question you need to ask from yourself, or you need to observe that in other people. Now let's talk about what we can do about that. Like, if you cannot afford to go to doctor at the moment, and how we need to manage our anxiety. I think we'll ask the question later on. So let's try to see how somebody can manage their anxiety, or if they're feeling low, if they're feeling depressed, how can do that. Get active 30 minutes before brisk physical activity daily in ideal, but not even 10 to 15 minutes daily can help. Depression can limit activity, but try to push through it. It means that you might have seen a lot of people, or many people who are struggling, who they don't want to go out. You need to try at least minimum you can do, and minimum what you could do, just go outside your room, go outside your block, go to the market, and start managing yourself slowly. You cannot bring change in your life at once, and other people cannot do that. So what you could do over here is just try to be more, you could say, to be a little bit active. Try to change yourself something. You could change your room setting. You could change your, you can change your closet. Okay, somebody's asking something. Thank you so much. Just got a message. I will just upload the recording also for what we are talking about today. So first we talk about getting active. Next, taking nourish your body and eat well. This is important because try to eat whatever you can eat. It's not about eating something fancy. When I talk to my client, I was talking to my client last week, and I just asked her, when you eat. She said that I wake up and I stay in the bed. I, like, for example, if I wake up at 11 o'clock, I stay in the bed and I don't move something. I don't want to move anything. And when it's until it's lunchtime, it's 2 o'clock, and then I go and then I eat something. And we don't understand that our body needs energy. When we don't have energy for our body, then we can feel nausea, or it can give us low energy. It could, lower our blood pressure also. So we need to understand that eating is very important. Energy is very, very, very important, especially for those people whose body system is all the time active, who is trauma driven, who is all the time in the state of fight, flight, freeze and fawn kind of response. So for them, energy is very important, because our brain is also taking energy, and brain need more oxygen and brain need more food as compared to our body. So if you go outside, your brain need more oxygen, you will get fresh oxygen in that way. And if your body is well nourished, you're eating well, and you're trying to eat and avoid, it's very important to avoid high fatting body and processed food and alcohol, because there are a lot of people who, if the moment they get anxious or they're feeling depressed, they start consuming alcohol. And there are a lot of people who start consuming chocolates a lot, and they think that we are feeling better after that, and they don't understand that your body go this side and your energy drop at the same pace. And you need to understand that sleep is very important for everyone, and try to take enough sleep. Also, journal is very important. And if you don't find somebody to talk to, what you could do over there, you can start journaling those things. You can start writing about those things, what you're feeling and how you're feeling and what you feel in certain day. And it will also help you out to understand that what are your triggers, because sometimes it's very important to understand that, because you don't understand. Sometimes if we ask somebody, they said everything was going normal, and at once everything get upside down. So there might be some trigger in the environment which upset them. There might be something in the environment which make them remember something old, something trauma kind of an event. So you need to understand, when you will do journal and you will write about your experiences, your daily routine, then it will help you out to understand that why you were feeling certain things and how you can work along that. And sometimes when you're writing, it's more like that, when you're thinking, you don't think about every aspect. When you write it down, then you understand that what I am thinking, and it also gives you clarity of something too. The other thing is that challenging your thinking, these are some type of exercises that we do when we are working with a client, that we ask them to write something. We ask them to bring a reason for that, which could be accurate reason. Because sometimes when they are thinking about something, then it is not an accurate, it is something people are talking about them. For example, if somebody failed an exam and the person thinking, I'm not a good student, and when we ask them, why you're not a good student, did you never pass your exam, that person says, yes, we passed my exam the last time. I'm just giving an example of my one of my patient I was working with. And when I said that, okay, and even he was a position taker too, he took a lot of position too. So we just reason about that thing, that if you can do that in your life, it means that you can pass the exams and you are capable of doing better than that. So it's more like you're challenging his thinking, and you're not doing something in that, but this is something from the person's life that help him understand that he can do certain things. And why he was saying this, because other people said that about him, that you cannot do that, you don't look smart, you don't look in certain way, like for example. So challenging your thinking, that's how it works. And limit rumination. So rumination is something like rehearsing some thoughts, memories, and movement, the part of depression. It's more like when you're in some kind of phase, you're thinking about that all the time. If you have some trauma, even you're thinking about that all the time. And sometimes it's difficult to say to someone that stop thinking about it, because it's not possible, your brain is working all the time. But if we try to understand that, okay, somebody is not able to understand something, but there are a lot of good helpful books for that person that could help that person, so that person can do that. The other thing is that it's very important to have purpose in your life. It is very important to have some goals in your life. What do you could do about that? Set some realistic goal. Sometimes people are anxious and sometimes people are depressive because they are not able to meet their life goal. For example, if person is not feeling good because he's not able to do good in job, and the job is something which is difficult for him, maybe, or maybe the job is something which is not according to his mood, maybe not about even the mood, according to his abilities, is not able to do something good over there, and the person is not able to perform very well and he's not able to utilize all the skills. So why not change that job? So if your goals are realistic, then it is going to help you out to track down, tackle the goals on the larger scale, and it's also will help you to understand that what you can do about if something goes wrong. So set a goal. It's very important to understand that if there are a lot of youth who say that we don't understand that what is happening with them, or what they need to do in their life, because they're so anxious. And a lot of people, when you ask them what you want to do in your life, then they will not able to answer you that. They don't even have a purpose. They don't even think about that what is the purpose of life, and they don't even have a goal. So at least you can set a goal and you can follow that goal. And the other thing is reduce procrastination. It means that sometimes when you're doing something, you feel so low, like you're feeling very lazy, you cannot do certain things. So if you reduce the possibility of having such goals and having such tasks that you can achieve next day, and having a schedule that you can fulfill instead of giving yourself a difficult schedule, it is going to help you out. And then you can also do that, avoid difficult tasks in the start. Or some of my clients, you know what they do, they do difficult tasks, or they mix up the tasks. One task is easy, second task is difficult, third task is easy, fourth task is difficult. So when they see that we are able to do all the tasks in our daily routine, then it helps them out. And also help them accomplish something, and it's also help them understand they can do things effectively. Okay. And like I said, that avoid making big goals at the moment. It's also important you to understand that avoid doing big decisions until and unless you are fully sure of something. Complete or acting on major life decisions should be avoided until your cognitive and decision making abilities are sharper. If you're feeling something, if you're not okay and you feel that your body is not feeling okay, you can avoid doing certain decisions and you can take a break from certain things, and that is going to help you out, and it is going to retain your body again, and it's more like you can recharge yourself and you can recharge your energy. Engage in healthy and joyful activity, and try to go to those people and have a friends that you trust, and tell him that you're going under certain things. Like the other point is stay connected. So what does that mean to stay connected? Try to talk to your friend about certain things that you're facing those kind of problems, and then you might both of you can make out you could say a solution for that problem. So it is going to help you out. And practice self-compassion means that try to do those things that make you feel better, the things that you enjoy when you were a child. It's the next slide. Okay, now I just said this point in some, you could say, small slides, some points. Allow yourself to feel what you are feeling. It means that when somebody's crying, we ask them stop to cry, and when we ask them not to cry, means that we are negating the importance of feeling sad. We think that sadness is not emotion, but sadness is also emotion. Anger is emotion. Crying is also, people do cry out of emotions. So when you said that stop crying and just feel happy, it means that you're not able to understand that all the emotions are important. So try to feel everything and let you feel. If you're sad, it's okay to feel sad. If you feel angry, then it's okay to feel angry, but try to talk about your feelings, that this is what I am feeling. And if you don't have somebody around, if you don't have a friend, if you don't have a company that is trustworthy, then you can write it down and you can understand that how you're feeling, because at least you can understand, because that is your life, and that you know about yourself. you know about yourself, it's going to help you out. Next thing is do something that you have control over. And sometimes people are feeling bad about things which they don't have control over. For example, uh, you go to the office, and in your office there are certain things that you're not able to do certain things. For example, there are some promotion going in your office and you're not able to do something. What you can do over there, you can control your actions into certain things. For example, if somebody is fighting in your there's some fight going around and you're not able to do something about that, but you can do something that is going to help you out. For example, why don't you go and complete your task? And what is the way to look toward that fight? I think you're in an office and there is some authority over there, and if you talk to that authority, that could help you out to understand, and that could help you out to um, at least you will talk about yourself and you will talk about your feeling that this is something that somebody said this to me and I'm not comfortable about that. So it's more like that you're going toward a proper way, and that could help, that might help you out. And that person is called in the office and somebody would ask him why you did that. The other person is not comfortable. So it's more like if that person did something or not, but at least you over there, you stand up for yourself. Aim to get a good night's sleep and try to sleep well if you can. Sometimes people are not able to sleep at night time. So but there are certain ritual which people perform and that help them to sleep. So try to sleep, and when you're sleeping, try not to watch maybe movie. Sometimes people sometimes it helps some people, sometimes it don't help people. And sometimes people are using a lot of mobile phone and there's so many negativity. And if somebody's like I'm working with a girl and she have some let's say that she have death anxiety, she have anxiety, so all the time she's thinking about death because she has some trauma associated with that. And whenever she saw a movie which have those certain things, and whenever she saw a news, then she start feeling anxious for 2-3 days. So it means that how you can eliminate those things from your life by not using maybe overused of something, overuse of social media. Try to eat balanced meal, and we talked about already that if you're feeling you're anxious and you have depressive mood or whatever it is, whatever you're feeling, and you don't have energy, and you don't have energy to uh, you know like sometimes people have that say that they don't have energy to drink water. So try to like they were saying, try to control those things as much as you can. So try to eat something that is going to make you feel better. And it's not like if you start, oh, I'm going to gain a lot of weight and things like that, start doing exercise about that. But the point is you need to have proper energy in your body is important. Energy is very important for your body. Next thing is try a walk around the block. And sometime if you change the place, it could, because you're sitting in a place and you are you're thinking about some traumatic event and you are saying that this person did bad with me, this person did bad with me, and it's going to give you a lot of exhaustion. But if you go outside, go to some some field, and you feel, maybe you feel little better because you just go outside and you see a lot of things in your surrounding. You might see your friend over there, you might see somebody, even if you're not talking to them, but when you will just see them, you might see some animal in the area around. It will just change the surrounding around you, and it could change your thought pattern somehow. Reach out to the loved one, and I'll talk about that. If you have some friend, if you have some colleagues and classmate who could help you out, that could understand, that could help you understand, or at least you need a shoulder to cry, or you need somebody who can listen to you. Another thing is maintain a routine, and it's very important. If you not maintain a routine, and you might, because you're already going through certain phase, and you might forget a lot of important thing, and it will make you feel more, you might also feel bad about yourself and bad about your day. What you could do about that? Just make a routine for yourself, and you can from routine means you just schedule as much as you can. Like it could be 3 or 4 things in your schedule, and in the morning you need to do this, then I will go to office, then I will eat something, then I will come back, and I will go to my friend, and I will go to my gym. So this is kind of a routine, and try to have a routine as much as you can, and make time for rest and relaxation too. And if you do all the time all the thing, like if somebody is doing 24 hours that much work, and plus you are having your mental work all the time, so the point is, for some time, no social media rule, no technology rule. Don't try to talk to anyone, and just stay wherever you are, and feel better about yourself. Maybe you don't, maybe it look like that, how you can feel better about yourself. But if you stop everything, then it give you some time with yourself, that who you are, what I'm feeling is certain way. Either I'm sad, either I'm angry about something, and you will try to meditate over that thing. So that's all for today. Okay, so that's all for today. And do you have any question? You say you join us late. No more. Do you have any question?
I think you've explained everything very well. And the only thing is that my therapist also used to suggest all these things, but I
Mhm.
would struggle practicing them.
Mm-hmm.
And then we've realized that I don't have self love. And today, she was able to tell me that there are two Nomas. One Noma wants to heal, and another Noma wants to stay in the past.
Mm-hmm.
So, in order to heal, I need to defeat the one who wants to stay in the past.
Mm-hmm.
Otherwise, there will be a conflict forever.
Mm-hmm. Okay.
So that was a revelation for me, and that brought a smile on my face because I was struggling a lot between like why I can't heal myself,
Mm-hmm.
why I can't go for a walk. Even if I would go, I wouldn't enjoy it. I would just come back after 10 minutes.
Mm-hmm.
So now I'm able to realize.
When we talk about self-love, if you ask, I am asking this question from my clients. Do you know that how to love yourself? They don't understand it, how to do that, because we are not raised that way. When I ask them, can you forgive other people? They would say easily. They will tell me, yes, we can do that. It's a very wise thing to do. And then when I ask them, can you forgive yourself? There's a mute. They don't answer me. Say that how would we be able to forgive ourselves? How? Let me quote some of my client verbatim over here. Verbatim means what they said. How can I do that? How I was so foolish to do that thing. How I was so, foolish to understand that how I was not able to see something that that person could do that with me. Like in case of somebody did something with that person. So, and they are hating themselves for that thing. They're hating themselves for doing that decision, and they don't understand that they're still human being. Like for example, you were saying something. There might be something about Andy and Andy conflict over there, that you're not able to do certain things, and those people who have depression, anxiety, that is also under coming under following the model of Andy model. But the point over here is that, like I said, a lot of things, and it is not easy for everyone. But you might heard that I was saying that at least do as much as you can do. You might have heard this. I was saying this again and again. Do those things as much as you can. If you will say that, oh, you have a very strict routine, but those who are ADHD, they cannot do that. It's very difficult for them to stick to that thing, because it's more like a kind of a PDA, pathological demand avoidance, and that kick in, and they, if you do not able to do one thing, then you will feel, oh, I am not able to do that 10 things. So there is a very complex phenomena around healing thing, and around understanding something. So the more we try to, love ourselves and accept ourselves who we are, and try to look ourselves the way we want other people to look us. People want us to be confident. People want us to do something. People want us to do, but the point is, we want to do that thing, and we don't want to do what we want to do. What we want to do, and we want to have something in our life. We want to achieve something in life. We want to have a goal in our life. So it's more about what you want and what you need. Need and wants are two different things. And what is your need? You need some friends. Maybe you don't need some friends. Maybe you need some job for yourself. Maybe you don't need some job for yourself because you have resources, or maybe you don't have resources. So this is the question, this is the struggle all the time people have. But at the end of the day, people know that what they are, what they could do. And maybe some
Yeah.
people don't understand that, but if somebody do something mean with somebody, they know that we are doing that. People think that, and they make you feel like that they don't care, that they are mean to you, but inside they are getting bitter and bitter and bitter and bitter. And one day they are going to come the guilt over at that bitterness. So we are not here to judge people on something that you did this with me, but the point is that what you're going to do about that. Tell those people that you are not comfortable with those things. Tell them, and just walk away from that thing which is not comfortable. Maybe that is not your cup of tea. So I think that's all for today. My client is waiting for me. So thank you so much for coming, and I'm sure you are in the group, and you will able to get all the notification on time now. Thank you so much for coming.
Yeah. Thank you. Take care.
Thank you,
Bye.
Sherry, for your sharing your experiences. Thank you.
You're very welcome.
Okay, I think Isa also jump in, and let's ask if he have any question. Actually, they are from South Africa. They're from Gambia. They're from different region of Africa. So sometimes they have issue in the internet. Hope it's working now. And let's see if he have any question. And if he don't have, then we are going to say goodbye. Still joining. It's okay. It might take some time. But yes, Isa, do you have any question? Still connecting. Isa, can you hear me? Do you have any question? And there was some person with the name of Saudu Tamba, difficult name. He said, thank you so much for the wonderful piece. I've learned so much and I had to go. Thank you so much, everybody who came today and give us some time. So see you for the next session, and let's see what we are going to discuss in the next discussion. And you can give your suggestion also that what we need to discuss, just in the form of discussion. So thank you so much, Nauma. Thank you so much, Isa.
Thank you. You're welcome.
Bye-bye. And by the way, a lot of their community is Muslim too.
Oh, okay. Allah Hafiz.